Okay, I guess this is part 4. This is another carbide, but it's covered with like a green Teflon, another aggressive burrs. And these aggressive burrs, you know, if you're a beginning nurse, you're going to want to ease yourself and really feel comfortable before you start using these aggressive burrs. I also strongly recommend that you use magnifying glasses. I have other videos about my little bag of tricks. I use magnifying glasses that go over my glasses, so I've got them over my bifocals, and I use a headlamp, and I'm very comfortable, and it's like doing microsurgery. So I very, very, very rarely ever nick anybody or hurt anybody. And that's what I'm trying to impart to you. I'm trying to give you these tricks so you have the same results. So those are the carbides, a couple different varieties. Now this is a new one to me, which I love, and this is from Medicool. I haven't found a source less expensive. I'm not sure if they're as expensive as the carbides, but it is ceramic. Again, very aggressive, comes in different shapes. You should know what you're doing with this. Wonderful. It can kind of be used interchangeably with carbides, and they're fabulous. Another new one kind of to me is a stone. And I like this. This is good for kind of smoothing off fungal toenails that you've reduced. So you could use it maybe interchangeably with the diamond and the ruby, but stone is another material. And then we have the old standby, the emery. Now we're going to get into shapes and sizes. I have some interesting shapes here that I bet you haven't seen before. This is an emery, disposable. A little tip about this: if you have a regular client and you're using an emery, you could actually take this off, maybe spray it with a little disinfectant, put it in a little baggie, put it in their medicine cabinet, and use it for them each time that you see them. I feel okay about that. These are good ones to learn on. They're kind of like the bumper wheels, training wheels on a bicycle. Anyway, it's a good one to start. It's also good for homeless shelters, multiple patients. You can discard them. They can be a little pricey, so you got to shop around. I can't remember where I got them, or Medicool I know does have them in different shapes. This one is more of we'll get into the sizes and stuff, but I like them really small. This one would be good for a big callus, maybe a big toenail to start, but I like the smaller size of these. Okay, so that's it for the materials. Diamond ruby, carbide, furry carbide, regular carbide, that green Teflon coated one. Then we had the ceramic, we got the stone, and the emery. So now I'm going to get more into the shapes, and there's so many different shapes. I don't even hardly know where to begin. So I'm going to randomly just pick. Okay, I've already talked about the terminate. So I'll go with my top several ones first, and then kind of, I think you'll get the gist. So this one, again, the Terminator, you can get this on Medicool. It's under the professional drills, they're calling them. They're awesome. There is another size to this, which is this one. This one is gold, which means there's different textures. So the gold is fine, silver is coarse. I think this one is a gold fine. And I call this the in-betweener because you can do soft corns. If you're very careful, even though it's very aggressive, it's very effective. You really have to be skilled. You have to have not shaky hands and know what you're doing, but it's awfully fun. So that is the taper one. And then there is the rounded tip, which is the same size, but it's different shape at the end there. So this might be a little safer. Okay, computer, what have you done already? Oh, I didn't turn it off this time. I'm using my Mac laptop, and I hope it comes out. I did this whole segment this morning, and it froze, and it was totally a waste of time. But I guess it was a good dress rehearsal. Okay, oh, the other shape that I love of that furry carbide. So if I have a really humongous nail, I'll start with the Terminator first, and then I'll go down. Ooh, this one's got a little bit of 4x4 on it. Yeah, and that does happen, and I just sterilize it with it and use it. I'm terrible. Anyway, this one is a little tree-shaped one, and that could be the next step down to do some more shaping. Then you could go to those other two styles, but they even have these little itsy-bitsy. Let me see, where is the small one here? Oh, here's a pear-shaped furry carbide. So there's all sorts of different sizes. And then, oh, here it is, a little tiny one. So this you might be able to use on IPKs on the bottom of the foot. And there's a little rounded one too. And then there's all these Where are they? That's a better view. Okay, there's multiples of these, but you can tell there's all sorts of, you can really get carried away in this. Okay, so other shapes that are wonderful are, there's this long, oh, well, I love these the little diamond ones that are narrow. Oh, there's even, look at this, the difference of these two. Okay, where am I? I am sorry, I'm not great at this. Okay, this little tiny one, if you're disintegrating the side of an ingrowing nail, you can go way down into the corners with this and almost do a partial matrixectomy. You can just disintegrate that spidicule with this. And then, you know, that's another shape of one. And there's just so many shapes and sizes. Oh, here's one, a little tiny ball-shaped one. And many of these diamond ones I got from woodworking sets where they're like $10 for 10 of them. And they will have a style in there that you just want to throw away. It's too dangerous. You wouldn't even want to use it on somebody. And that would be something very pointy like this. So if you're going for the cheaper sets to just, you know, get used to different sizes and shapes and experiments with, don't use these little sharp ones. If you cough or sneeze or something or whatever, you're going to really have a problem. So my favorite, this is actually a ruby, but my favorite one, I can't remember where I got it, but it's flat on the top. So it gives you a bit of an edge, and then it's very long, so you can really go over calluses. You can get into fissures and stuff with this, is this ruby one. My other little favorite, let me see here. Oh, there's little sharper, not the sharp that you want to throw away, but you do have to be careful with this. This is also a diamond one to smooth off the sides, especially of ingrowing nails that you've gone down the side. Okay, I think you get the gist, right? Okay, I have, you know, probably 300 or 400 bits here. I've got more over there. All different sizes, shapes. You just have to look at the job you're doing, pick the appropriate material and pick the appropriate size and shape, and then experiment around. I do suggest if you are new, it is so much fun and it's so helpful, and you don't have to be quite as uptight as if you are, you know, with a private patient, is volunteer at a homeless shelter. Do some foot care. It's a great place to work in a relaxed environment without being, I don't know what I'm trying to say, but anyway, it's a good place to get some skills. Whoop, where are you? Okay, before you go out. All right, so that's that. It's kind of distracting doing this videotaping when my video turns off. Well, I'm going to go back to the emeries now. The emeries, like I said, I showed you the bigger one. Yeah, I showed you the bigger one. Now, this is the size that I like. I actually don't have a emery cap on it yet. This is just the rubber tip. And I think they have these at Medicool too. And try to get a bulk price on them or something like that. But I would not get the big ones of these. They're horrible. If you put them on high speed, they start wobbling, and then they can burn, and the heat can build up on these more so than the other ones. But my interesting shape that I have, whoops, I think I just threw it on the floor. They make, yeah, here it is. And I can't remember where I even got it, but they make an emery one that has a pointy tip. So you can get into the corners, especially on big toes or in big cracks or something like that. But again, be very careful. The heat builds up and you'll find that the people go ouch a little bit sooner. So you really have to know how long you can keep it there. I do this thing where I go tap, tap, tap. The thicker it is, the longer that you can put it down there. But techniques are actually for another video. So let's see. I think processing. Somebody specifically asked me from a Facebook page that I'm on about processing these instruments. Ideally, you're going to want to sterilize in an autoclave. And I think that's the law that's starting to go around up in Canada now. It's not here in the US. I did have a Prestige autoclave and it broke. So I am actually in negotiations with a really wonderful international autoclave manufacturing company who I believe is going to donate like a $4,000 or $5,000 autoclave with the printout to my organization, kind of in exchange for promotional considerations. And they may also be sponsoring me doing a real CE unit kind of thing on infection control down the line, but there will be more on that later. I've got some really good companies that are trying to help me, and so that's fun. Okay, so you want to do autoclave preferably, but if your autoclave breaks like mine did, then you have to do chemosterilant. The trick is there are different styles, or different manufacturers, different kinds. Kerr Company donated Wavicide is one of them, but Cavicide is the one. I'm sorry, let me get it over here. Cavicide, I got from the Kerr page, Kerr, Kerr Products. That's a dental company. They gave me so generous. I want to thank them. They gave me tons of the clear packages to put your instruments and stuff. So Cavicide is great for high-level disinfection. For sterilizing, it like takes 10 hours. And if you're using a good carbide in a liquid sterilant for 10 hours, you're going to ruin it. So that is the problem. You really have to, for high-level disinfection, you can get away with it. It's not best practice, but actually that's what's legal in the United States. I try to do high-level sterilization. But so with this, it would be 10 hours, and read your instructions and have your medical safety data sheets, MD, whatever they're called, have those around for your references, but read your directions, very important. The company that I love too, which is in Canada, and I'm going to go visit them, I think in June, Virox makes Preempt 20. Whoop, there I go again. Preempt 20 will do high-level sterilization in 20 minutes. It's a hydrogen oxide. Oh, gosh. Hydrogen peroxide. Can't speak. Sorry. It's been quite a morning. Based 20 minutes for sterilizing. The interesting fact about this is it's not legal or FDA approved in the US. And they were actually a little shocked because they were telling me about another product. And I was saying, well, the Preempt 20 is great. And she's going, oh, you're using that in the US? And I go, yeah, I order it. They send it to me. And I know maybe I'd get in trouble, but I really don't think the FDA is going to come in here and bust me. So I kind of walk, to me, there's a lot of gray area in life. When it comes right down to it, I don't worry about those little details. I know there are other nurses that is their life. They are by the book, everything. I'm not one of those. I am more of a rebel, a maverick, whatever. Some people appreciate that in me, and some people think it's appalling. So whatever, you decide. So I'm using Preempt right now until I can get a autoclave. 20 minutes, but put your timer on. Don't let it stay longer than 20 minutes because then you're at the risk of corroding. And I do put my stuff in an ultrasonic cleaner first with some Miltex. A squirt of this first. And then, except that broke too, so I'm going to go to another company. I have all this ancient equipment. It's all breaking. So I am doing it by hand with a little brush. But you can wash with a detergent first, rinse it, dry it, then put it in the liquid chemosterilant for whatever length of time, and then take that out and then rinse it with sterile water and then package it. Oh, and I'll show you this little tip. I think it's pretty clever. I have another more clever idea, but that's coming down the road. So I got these little individual packs. So now what I'm doing, I'll show you okay, so I'll put this in here like that. I will close it up, and then I will package another one. And I try to do all the same material in a row, like all diamonds. So I have a roll of the diamond things and a roll of the carbides. But then on this one, I'll take off the sticky thing, and I'll put it on the back of this. So I'll get a whole tail of these, and then I can punch them out. And that way, I used to, and still do sometimes, carry them around. These have all been terminally sterilized, etc. But you're going to cross-contaminate if you take them out with your dirty gloves. So this is a way to keep things cleaner, and you could if you have a really good autoclave, you can sterilize them in this. In the smaller autoclaves, I just autoclave with bulk, take them out, put them on kind of a sterile pad, let them dry, and then I package them with clean gloves, picking them up by the tip. I feel good about that. Ideally, you'd want to sterilize in these packages. So those are my tips for the day. I hope this video comes out. I hope you have gained some little bit of knowledge from this. If you have any specific questions, you can write it in the comments and I'll address them later. Have a good day. Gotta go. I'm on granddaughter duty.